time. I'd just like to welcome you all to the webinar, and I'd like to thank Teresa for giving us the opportunity to present some of our work. You can see all of my affiliations there. So I'm based within the Sydney Children's Hospital and School of Women's and Children's Health at University of New South Wales, Sydney. And I sit within the Kids Cancer Centre within the hospital. And it's kind of like a joint or a conjoint position, but my role primarily is a researcher. And I just wanted the opportunity to introduce, if I can get my slides to progress, here we go. Okay, who we are. So I'm a researcher. My day job is really focusing on looking at the outcomes of young people who have had cancer and also supporting their families through research and then through implementing research, which is a big focus of my own program. I'm also a trained neuropsychologist, and I'm a mum of a toddler, which I like to just give as a bit of background. And I'm absolutely thrilled to have here with me Clarissa, who's sitting next to me, and I'll let her introduce herself really briefly right now before we get on to what we're talking about. Over to you, Clarissa.
Sure. So yeah, my name is Clarissa. I'm a PhD student and candidate here at the University of New South Wales, and I'm working with Joe on my PhD research project, which I'll get to talk with you a little bit about later on in the webinar. I also happen to be a two-time cancer survivor myself. I was diagnosed with acute lymphoblastic leukemia the first time when I was 2.5 years old, and then relapsed and went through treatment again when I was 13 years old. I'm very fortunately now about 10 years post-treatment and doing very well. And I've also written a book for young people with cancer, which I'll also hopefully have a chance to chat with you about later on in the webinar.
Great. So thank you, Clarissa, for joining me this evening. We will be talking about what do we mean by social outcomes. So giving you a bit of a framework and a definition that I use in research land, but it's also quite applicable and translatable to real life, I think, which is quite important. And I'll be talking about how using that framework, cancer during childhood and adolescence, can really impact social outcomes. I'll also talk about what support is out there and what we know in terms of the evidence base for what works. And I'll talk about what research is really needed and coming up, and that's where Clarissa will jump in and talk about some of the work that she's hoping to achieve through her PhD. So without further ado, let's get into it. So what do I mean by social outcomes? Well, really, I like to think of these as covering three large parts of life. So really looking at friendships, education, and career. And under friendships, we just don't mean that quantity of friendships or the number of friends that a young person might have, but we also are interested in the quality that those friendships take on. So are they intimate, are they stable, and are they ones which people would say, I can call on this friend in a time of need, or yes, I have someone to talk to when I'm under stress or crisis. In terms of education, we don't just mean academics. I think often, and I'm a neuropsychologist, so I do get caught up on this, we talk about actual grades and academics, but it's a lot more than that. So it's actually engaging with teachers and the school community and how those connections are going in terms of with peers, and how that facilitates, I guess, education completion and further training. And we also are interested in, as I mentioned, that quality of completion, so the grades and academic performance. And then the third area of social outcomes, which I like to think about or think is quite important, particularly when you look at young people's life trajectory, and you may even think or reflect on your own aspirations as a child or an adolescent and a young person. You're always thinking about, what do I want to be when I grow up? And we're kind of geared towards this career development and establishing our identity around what we do as a job. And when we're interested in social outcomes, we're interested in how is a person's career progressing, and also how satisfied are they with that career. So they're the three important areas of social outcomes that I like to cover off. Or like to have in the background when you're thinking about these sorts of things. So I'm not going to belabor these key points, only to say that the key point about childhood cancer and its impact on social outcomes is that diagnosis happens at a time which is generally considered developmentally vulnerable for the development of social skills. And this is a combination of the intensity of the treatment and the severity of the treatment, as well as the type, but also the fact that it's long-lasting treatment. So whilst childhood cancer is rare, as you all know, it does happen at this important stage of life for future success in terms of education, career progression, and life satisfaction in terms of social role functioning. So lengthy treatment equals lots of disruption. Lots of, for those of you who are mums on the line, I can see a few women there, so I'm just assuming your mum's there. You'll know that there's a big disruption to your family life. And what comes with that is a disruption to usual developmental things that you might have done in the context of your family life, and also the normal tasks of socialisation. So even thinking about attendance at preschool or childcare as being an important aspect of development of emotional and social wellbeing, which does have an impact on later development. I like to use the social cognitive functioning framework, which was developed in the context of brain injury. I think that what's really nice about this is it captures a couple of important issues when we're thinking about an individual child and what the impact their cancer and their treatment has on their ultimate social outcomes. So when we're considering internal or external factors, it's important to consider both the individual level factors, so their age or physical changes that might have occurred, but also the external protective factors that might exist. So being part of a family or environment which is supportive of social interactions. And in terms of other external factors, keeping in mind that there are ongoing absences from school that need to be taken into consideration. In terms of further individual level factors, keeping in mind diagnosis, age at diagnosis, and actual treatment are key factors which are going to be influencing ultimately the development of social skills and social competence. So let's have a look at what this might look like by age. I've grouped looking at social outcomes and impacts broadly into early childhood, middle childhood, adolescence and young adult years. And what I've got here on the left is highlighting what are considered the key social milestones for that age, the significant social relationships, and then how this might be impacted by cancer. So for young people between the ages of 0 and 4, we really know that that's a key time of sensory motor development, where babies and infants are developing really strong attachments with their primary caregivers and their family, as well as beginning to develop their own language and thought processes around communication. When we interpose a cancer diagnosis and treatment on this stage of life, what we can see is interrupted or delayed sensory and motor processing, separation anxiety at procedures, and that can be because an infant or a small child has formed their bond with their family, and then all of a sudden they're thrust into the situation where they've got to undergo procedures where mum and dad can't be by their side for the whole time, and that can be quite hard for them. Interrupted or delayed language or communication can occur at this time, and that can be as a result of missed opportunities for socialisation, either with adults or same age peers. When we look at middle childhood, the key social milestone that occurs at this age is really establishing a theory of mind. And what do I mean by that? So there are all those skills that are really about understanding what other people are thinking and feeling. So empathy, understanding how your actions can impact others, those sorts of things, and as well as group identification. So you'll see at this early primary school age, what you've got is young kids who are starting to say, okay, well, this is my friend and this is who I am. I like music or I like sports. So starting to have that group identification through their hobbies or their interests. They still have very significant social relationships with their parents and caregivers, but this is where school friends or peers are really starting to come into the mix and are really important in terms of facilitating ongoing social development and social skill development, particularly around ideas of communication. So knowing about turn taking in a conversation, or understanding when it's your turn to stop talking and it's another person's turn to start talking, and reading those cues in conversation. And what you can see at this age is that school participation can be compromised, and there can be missed opportunities for socialisation due to treatment, which is pulling kids out of this usual setting. And you might see some delayed or impaired cooperative play, and some delay in potentially obtaining theory of mind. So moving on to our adolescent group, this is really a key age for development of social identity, and where young people start to define themselves more and more by the connections and the peers that they have, and also their role models. Parents are still in the mix, don't worry about that. But more and more friends are really critical at this age. And so facilitating connection with friends is really important at this age. And high school achievement can, as a result, be delayed or graduation interrupted in this age cohort. Moving on to our young adults, this is really where we see young people establishing their social independence. So more and more friends, school and work peers become more and more important for facilitating that social identity and role that they exist in society and what they do for work or who they want to be. And what you might see here is some delays in transition to living independently, gaps in higher education, work or employment interruptions, hindered achievement in terms of financial independence, and difficulty achieving or maintaining intimate relationships with friends or peers. So what does this look like in terms of the literature? So we know that high rates of absenteeism from school persist beyond treatment. Many use special education services and many repeat a grade. What's particularly interesting when you talk to young people who have survived cancer about their school experiences is that they'll often report feeling left behind, and that getting back into school is quite challenging because they feel that they're operating at a slightly different level to their friends, particularly if diagnosis and treatment happened in adolescent years. What's really, I think, a silver lining about a diagnosis of cancer during adolescence years, and I would never wish it on anyone, is that these young people often develop really beautiful social maturity skills, which means that they're very capable of communicating with adults or people who are older than themselves, but they can then struggle with really connecting with their same age peers because they feel different. They kind of don't get why there's, you know, petty things, what they perceive to be as petty are talked about or just not that important. So that can lead to them feeling a degree of social isolation and anxiety when they've got to interact with peers. And we know that high school and university completion rates are either at the same rate as healthy kids or slightly below. That's based on population level data. So I think it's a bit hard to draw strong conclusions from that type of data at the moment. In terms of who is really at risk of I guess, impact on academic functioning is we know that kids who are diagnosed at preschoolers, kids who have had brain tumour diagnoses, cranial radiation, intrathecal methotrexate, and hearing loss is particularly associated with academic difficulties and poor social functioning, which may not be all that surprising. If it's difficult to hear your teacher or your friends, it's really hard to stay engaged in schooling, and it's really hard to stay engaged in peer friendships. So thinking about alternative ways of connecting with school or with friends could be really important here. Employment. So this is really an area that I feel is emerging in terms of research. I think that there needs to be a lot more work in this space in terms of looking at job satisfaction and obtaining independence from family in terms of the literature. So there's really very little here, and I just want to emphasise that when I present this data here, is that although there appears to be lower rates of employment, that could also be because for adolescents and young adults, their career trajectory is delayed. So they're taking slightly longer to achieve their career aspirations and goals because they're still undergoing training or education as a result of having missed out due to some schooling or university. But many will report in terms of interview data that they really need to readjust their goals in terms of their capacity, understanding what they can reasonably achieve. And this can be also seen in the context of education. So managing fatigue and attention is quite a challenge for young people post-treatment and is real and is lasting. And so needing to readjust those goals, it's often common in high achievers that they will find it really hard and really frustrating that they can't do what they were able to do prior to their diagnosis. And we know that employment is a really key factor for establishing independence. This data that I'm reporting here is US data, so I think, you know, we need to think about it in terms of a New Zealand or Australian context even. But adolescents and young adults do report lower family incomes in general, and unsurprisingly higher ongoing medical costs than the general population. So who's at risk? So those young people who aren't finishing high school are obviously at risk of achieving further career progression. Again, preschool age at diagnosis, cranial radiation, being female, a brain tumour diagnosis, and also having multiple chronic health conditions as a result of treatment places these young people at risk of not achieving their full career aspirations or employment goals. And moving on to our third category of social outcomes, let's look at relationships. So we know that young cancer survivors are less likely to live independently, and they generally report fewer friends and difficulties with peer relationships. But I think this needs to be taken in context, because often young people will report that although they have fewer friends, the ones that they do have are really, really important to them and really, really close to them. And it's more like they're family members rather than just your age group friends. We know that data shows that there's generally an older age for first romantic relationships. And maybe that's not unsurprising when you think that many of these young people develop maturity at a rate faster than their age group. So they might be waiting for their friends to catch up to them, which might sound interesting. And we also know, though, that there are lower rates of marriage, and some young people do report these really sad feelings of feeling abnormal or like damaged goods because of their treatment and changes to their physical appearance, which is quite sad and something that I think we can reasonably address within the context of our clinics. So who's at risk? Those people who have poor social cognitive skills, so communication skills and emotion perception, that sort of stuff. Again, brain tumour diagnosis, females, changed physical appearance due to treatment, and in AYAs in particular, reduced participation in social activities is associated with being male. having unmet information needs, and change fertility status. So a few areas there where I feel we could reasonably offer intervention. So coming back to this slide, I guess what I wanted to emphasise, and I hope that you've gotten a bit of a flavour so far throughout the talk, that although that there is significant disruption to these normal parts of life as a result of a cancer diagnosis during childhood or adolescence, there is both positives and negatives, and not to lose sight of the positives that can occur as a result of having been through this experience. Many families report feeling a lot closer and a lot more connected, and have good communication skills with each other. So a closeness which many families don't enjoy, particularly when their children go through adolescence and you see that typical separation from parents. But there are some negatives which I've shown through the data that's been presented. And I think it's important though to keep that balanced perspective when you're looking at this data. So what can be done? I really like this I've forgotten the name of the comic, Hobbs comic, because things are never quite as scary when you've got a best friend. And a lot of my work now is really focused on, well, how can we make sure that young people stay connected to their friends? And so the sorts of things that I'm going to present now are work that's been done more broadly in the international literature. And then I'll hand over to Clarissa to talk about her specific work and what we're hoping to achieve, at least within an Australian context. So let's talk about some information provision and communication support for young people. What our work has shown is that young people do want to talk about their cancer experience, but what needs to be established before they start to communicate with their peers is really, what are they hoping to achieve through their communication? Do they want more support from their friends, or do they just want to keep them informed and say, hey, I just want to tell you what's going on, but I actually really want to talk about this video that was on YouTube, or this movie, or this book. So really establishing goals around communication is important, and who they want to talk to. So is it peers that they want to share with? Is it really close friends? Is it teachers who they want to communicate this to their broader community? And I think a little bit of work around understanding likely peer reactions can be really helpful. We know from some work that's been done here in Australia with Canteen that sometimes peers don't really react the way that you want. They're not super supportive, they don't really get it. And there is a degree of emotional immaturity which is yet to develop in these young people, because they're not going through a cancer diagnosis themselves. They haven't been forced to develop, and so they can be unsympathetic or not say the right things, which can be really disheartening for a young person who might have taken some time to sort of work up the courage and say, hey, I'm having a tough time, but I'd really like to talk about this TV show or whatever. So in terms of communicating with friends, I had a look online, and unfortunately I couldn't find anything New Zealand specific, but Australia's Canteen does have some information around how to communicate with friends. But there's really no evidence on the efficacy of this. So a lot of these questions that I've presented here around establishing the parameters of communication is some work that I started a few years ago with a medical student, which we're now continuing and hoping to establish a bit of guidance around how to help young people communicate about their experiences with their friends to get what they want. So let's talk about information and support for teachers and peers. So thinking about the sorts of programs where either the nurse goes out to the school, as the case is in Australia, or you might have Monkey in My Chair. I'm not sure if that exists in New Zealand, or other sort of educational information support. The goal is to really increase the understanding of cancer on school engagement, and so really helping teachers as well as friends or peers understand the impact of fatigue and changes in cognitive skills that might occur as a result of treatment. I noticed that you guys at the Cancer Council Foundation have a really fabulous set of guidelines for teachers, so I just thought I'd give them a plug here. And there is some other information on Kids Health New Zealand in terms of information and support for teachers. What we know about this is that it's actually quite effective at achieving outcomes. So informed teachers are more supportive and more likely to make accommodations in the classroom. And I'm not just talking about academic concessions, I'm also talking about supporting peer connections. So allowing the use of technology in the context of the classroom to dial in to excursions if they're unwell to attend, or other sorts of accommodations. So keeping teachers abreast of what they can reasonably expect or achieve is really important. And we also know that informed friends means that there's a reduced risk of stigma and bullying, or young people are more likely to have a friend in their peer group, even if they've had cancer, but that's not a reason for exclusion. So they're more likely to have them as part of their regular social circle. In terms of support groups for connecting with others, I've got a few up here, and these can happen in the context of allowing young people to connect with other young people who have had cancer. And this is a really important opportunity to normalise and share experiences, because cancer during childhood and adolescent years is really rare. And the way I think that New Zealand probably faces treatment in the same way that Australia faces treatment is that the population is quite dispersed, and so the number of people who you might interact with, particularly when families get off the ward, is really, really scant. And these sorts of formalised activities are really nice for allowing that opportunity to connect and share experience. And they can happen through camps and also through chat groups online. And I know that Canteen New Zealand offers these sorts of things, but Canteen Australia has also just launched an online support group, which I believe is open to anyone in the world, as far as I'm aware, which is a really nice opportunity to connect with friends or with others who have had similar experiences. So unfortunately, we do need a bit of work around the evaluation of chat groups and online support. This is a really new space that we're working in, and I guess safety is something important to consider. So chat groups which are moderated by groups who have the capacity to moderate and mentor the group is really important, I think, in terms of thinking about safety. But I think we need more evidence of the efficacy. We do know that in a normal setting, face-to-face support is really valuable, and camps can show improvements in social confidence and greater perceived support from people with similar experiences. But there are limitations in the sample size evaluations of this. And so moving on to the last thing that I thought I'd cover off in terms of support, and that was some social skills training. This can be done in individual or group settings. It's typically delivered by psychologists, and it really is intended to train specific skills which are necessary for social interactions with peers, with others. So social skills might be assertiveness, handling teasing and bullying, making new friends, cooperation, empathy, conflict resolution. And it takes the form of explicit training, so explaining what we mean by assertiveness, what's appropriate assertiveness, and then demonstrating how to do that in a group setting. So imagining role-playing what that might look like in the context of a group setting. And it provides an opportunity for practicing from the young person's perspective. And one thing, I guess, that's nice about social skills training is that it's meant to establish a sense of mastery prior to even having to engage in the situation. So in terms of the evidence, the pilot studies really show promise with improvements in social skills and quality of life, but recent larger trials with brain tumour survivors, it's less promising and the results are less clear. One comment that I'd like to make about social skills training and that explicit discussion around what assertiveness looks like, or what handling teasing and bullying looks like, or how you might make new friends, is having a quite clear conversation with your child can be quite beneficial in this space, and talking about different ways which they might handle a situation can be quite helpful and empowering, and give them an opportunity to practice with you in a safe space. So in summary, we know obviously that childhood cancer is rare, but it does occur at a developmentally sensitive time. And because of the treatment disruption to schooling and opportunities to interact with peers, there is a risk of poor social outcomes in those three domains that I was talking about: education, employment, and relationships. There are a few factors which I think are reasonably consistent across the literature in terms of who or which young people will be at risk of these worse social outcomes compared to peers. And they are those kids that have received CNS disease or treatment, are younger at diagnosis. They tend to be the focus, I think, for risk when you're thinking about these sorts of things. And in terms of thinking about what can be done in terms of the research so far, I think there's good evidence for providing information to peers and teachers about what cancer is and what impact it can have on a young person, as well as the utility of social support and social skills training. But really we need some more research in this space. So with that in mind, I'm actually going to say thank you for listening to me, and I'm going to hand over to Clarissa. I'll let her open up her slides if you just give us a moment. I need to share that one.
Looks like it's on.
Can I just double check? Can everybody see the new set of slides? I might.
Shall I stop it? Turn it back on?
Yeah, maybe. Sorry about the recording. We'll just quickly.
Here we go.
Yeah. Okay, great. Okay, over to
All
Clarissa.
right. So we'll kind of transition into something somewhat related, but a little bit more specific in a space of what Joe's been talking about with social outcomes. So my PhD research is really focusing on social anxiety among adolescent and young adult cancer patients and survivors, and we're calling it the Social AYA study. Hold on one second, we're having some technical difficulties. Oh, here we go. So just to get started, I want to talk a little bit about why social well-being matters to me. I think anyone that knows a child or young person with cancer or is part of a family that's been through it, you know that social isolation is a big challenge. Missing out on school can be a big challenge. A lot of the things that Joe has spoken about. And these are all things I've personally experienced in my own cancer treatment journeys as well. And it's really a big motivator for me to work in this space. And so kind of related to what Joe has spoken about already, we know that survivors, particularly of adolescent and young adult cancer, tend to lag behind healthy young people in social outcomes, so education outcomes, relationships, employment, those sorts of things. We also know that research into predictors of which young people do well and which young people don't do so well socially is pretty limited. And so it's really important to be able to identify modifiable predictors, so predictors that we can really change, that we can target with interventions and programs to be able to improve outcomes for these young people. And we know that social anxiety might be one potential factor for this. In healthy young people, social anxiety has been directly linked with poor quality of life and poor social outcomes, including decreased work productivity and role limitations. So basically not being able to participate in your normal social activities every day. And previous research has also found that the experience of childhood shyness and chronic illness led to being 4 times more likely for young people to develop social anxiety symptoms in adolescence than just being shy as a child or just having a chronic illness as a child alone. And we also know that adolescents who had been off of treatment for a greater amount of time reported more symptoms of social anxiety. However, there hasn't been any research on social anxiety among young people with cancer since. And just to put it in perspective, those two studies were from the 90s. So they're a little bit out of date now, which is why we're really interested on looking into this a little bit more. So what exactly is social anxiety? Social anxiety is pretty common in adolescents in general. If you think of it just in terms of symptoms, I think we're all familiar being teenagers about worrying about what other people think of you, or feeling self-conscious, or, being a little bit concerned about being embarrassed, or, wanting to avoid activities where you might be the center of attention. But sometimes the symptoms can be a lot more severe and really prevent young people from participating in activities that, as Joe has mentioned before, can be really important in their educational and social development, including participating in class or social activities at school and developing friendships and intimate relationships. And when more severe symptoms do inhibit young people from participating in their social activities in a normal day-to-day setting, that might be diagnosed as something called social anxiety disorder, which is actually a condition that requires psychological treatment. And social anxiety disorder in the general population tends to develop based on experiences of poor physical health or negative perceived appearance, decreased exposure to social situations, and experience of traumatic events that have social impact. And one thing I think we can understand from these three pieces is that they're pretty typical of the cancer experience as well, which is why we kind of thought that this might be an issue for young people with cancer. And so we're really thinking about social anxiety as a missing puzzle piece in the social outcomes of young people that have gone through cancer. In one of our previous studies, which we interviewed 41 parents who had a child with chronic illness, about 54% of those parents reported that their child's illness complicated their social experiences, and 10% of those parents also reported that their child experienced social anxiety that really impaired their social functioning. And in our most recent study, which is really what led us to moving this area of research forward, we surveyed and interviewed 17 adolescents and young adults around social well-being, and about 44% of them reported levels of shyness that are really consistent with social anxiety disorder, and then 58% of them met criteria for a diagnosis of social anxiety disorder. And when we look at their interviews, in which they really explained their social life and the way cancer impacted their social life, this becomes especially clear. So one young female survivor who's 17 years old was just really hesitant to go to parties with her friends. She's in high school now, especially if she doesn't know people well, and she really wanted to make sure she had people that she knew really well to go with her. And even if she did, she still worried about what she looked like and if she looked attractive, and she felt like she constantly compared herself to others. And so that was really challenging for her because it made her very nervous to participate in normal social activities. And a young 15-year-old man said that he just felt like he doesn't laugh at things that normal people would laugh at. And he felt more shy towards his classmates than towards adults, which relates a lot to what Joe had mentioned before, in that young people tend to mature a lot faster than their peers when they do go through cancer. And this kind of adds another level of difficulty in being able to relate to their peers. And another young woman said that her mom told her that she felt that the cancer treatment had changed her because she wasn't as confident anymore. And that was a big impact for her, made her a lot more self-conscious about things. And she was especially concerned about people knowing about her cancer history. And if they did know about it, or if they wanted to ask about it, if she wasn't realizing that that's what they were curious about, or that's what they were thinking of, it made her really nervous. And finally, another 17-year-old female said that in every single social situation, she felt nervous and she worried about it. It could be something simple, or it could have been a larger event. But the anxiousness around that social interaction really caused her to question if what people were thinking about her and if they disliked her. And so that really led us to develop a couple of research questions around survivors and patients' experiences with symptoms of social anxiety. Our number one question is really how many young people with cancer are meeting diagnostic criteria for social anxiety as a disorder. Because no research has been done in this space yet, we actually have no idea about how prevalent A, the symptoms of social anxiety may be, but then B, how prevalent the actually more severe symptoms of social anxiety disorder might be. And we're also really interested in knowing what the course of social anxiety disorder might look like among young people with cancer. And what that means is basically, does the onset of social anxiety happen sometime during the cancer treatment experience because of cancer-specific experiences that they're having, like social isolation? And we're also interested in looking at what are the main negative self-beliefs and social cognition. So those are thought processes that happen for young people while they're participating in social activities that might underpin social anxiety disorder and symptoms of social anxiety in these young people. And we're looking at this mostly because social anxiety in the literature is said to really be developed based on young people developing negative thought processes around beliefs about themselves and also beliefs about how other people are viewing them. And lastly, we want to look more specifically at how cancer-specific challenges like perceived physical appearance and social isolation can contribute to and interact with young people's other pre-existing factors like their age, their gender, their relationship status, their employment status, to predict the development of social anxiety disorder. And so for our study, we'll be asking young people about a couple different social aspects related to their cancer experience. We'll survey them on symptoms of social anxiety they might be experiencing, so we can gauge how severe those symptoms might be, or if they're experiencing specific symptoms that might be particularly common for young people with cancer. We'll also ask them about their experience of social isolation and how that experience made them feel. We'll ask them about thought processes that they have in social situations, whether they're worried about what other people are thinking about them, or if they think a lot about social interactions after they have them. We'll also ask them about beliefs they have about themselves, so whether or not they feel good about themselves, or if there are particular things that they think about themselves that they feel might influence how others view them. And we'll also ask them about their perceived physical appearance and how much their emotional or physical health might interfere with their social activities, and also whether or not they've had other anxiety or depression at any other time in their life before their cancer diagnosis, just because this can also tend to influence whether or not people develop social anxiety disorder. And so the plans for our study are really to involve young people who have recently been diagnosed with cancer between the ages of 12 and 25. And we're hoping to recruit about 150 young people across 5 hospitals in New South Wales, in Australia. And we're going to be asking them to participate in a set of 3 surveys. So they'll complete the first survey sometime less than 60 days after diagnosis. And then the second and third surveys will be completed 6 and 12 months after diagnosis. And this sort of timeline is for us to be able to tell when symptoms really start to develop and what sort of parts of the cancer treatment experience or time points in it might influence the development of social anxiety symptoms and also social anxiety disorder. And after each of these surveys, we'll also give participants the option to complete an interview either in person or over the phone, or alternatively also via written response that will just sort of delve a little bit further into their social experiences and experiences with symptoms of social anxiety. And what we're really hoping to do with this study is use the results to create positive change in social outcomes for young people. And we hope to do that by developing and running a program to teach healthcare professionals who work with young people with cancer about social anxiety symptoms and about social anxiety as a disorder. And so our goals with that program are really going to be to address social anxiety symptoms in young people with cancer before they become severe enough to be diagnosed as social anxiety disorder. And we also want to ensure healthcare professionals know how to properly assess and address social well-being, especially symptoms of social anxiety, since we know that that's not a particularly commonly assessed aspect of health and well-being in oncology settings, at least in Australia. And so with that, I'll finish up, and I guess we can open up for questions.
Yeah. Now, let me just figure out how to... Yes. So is there any questions that anyone would like to ask us at this stage? Oh, okay. So I'll try and respond to a question that was sent via email very briefly regarding some, I'm not sure if the mum who submitted this question is on the line. If they'd like to raise their hand, they're more than welcome to. Or they don't have to, equally so. So the question was regarding some scratching behaviours that had emerged or started, from what I can gather, based on the question that was submitted via email after treatment had completed. And certainly some aspects of treatment are associated with scratching and itching because they can be quite uncomfortable. But I suppose as the first port of call, I'd want to touch base with the treating team to make sure that there wasn't something still residual going on there in terms of treatment or a reaction to something. But sometimes those sorts of itching and picking behaviours can represent an underlying anxiety or behavioural manifestation of anxiety, particularly in young kids. So I guess my first port of call would be to talk to the treating team and then try and get a referral to a psychologist, preferably one with experience working with kids with cancer. Obviously that can sometimes be hard with waiting lists. I'll leave this open for just a few more minutes, but I guess if no one has any further questions of us, I'd just like to reiterate again, thank you for letting us join you this evening via webinar from across the ditch and present some of the work or the space that we're working in and Clarissa's upcoming PhD, which hopefully will have some really important learnings which will lead to practice change ultimately in the care of young people with cancer who are experiencing social anxiety as a result of their treatment experiences.